Orbis was established in 1982 to teach and train doctors and nurses in the developing world to be able to improve the quality of eye care that they deliver to their communities. Since 1999, we've developed long-term programs in 12 countries around the world. And in those countries, we really work with the local governments and with partners to be able to really build the capacity of hospitals and the whole health system. Orbis has a particular focus on children, so we've developed over 50 child eye care centres around the world. We have around 500 medical volunteers, which encompass ophthalmologists, nurses, anaesthetists, as well as biomedical engineers, so we really cover the whole eye care team. Orbis has the Flying Eye Hospital, and its benefits are that it is a fully equipped hospital on board a plane. We fly it around the world, and it goes to countries where we've been invited in to be able to teach and train local doctors and nurses and anaesthetists and the whole eye care teams in the latest techniques and developments. We have a 48-seat classroom at the front of the plane, which is where your typical business class would be on a normal plane. Behind that we have our laser and treatment room, and then an operating theatre, and then a recovery room. So it really is all the necessary things that you have within a hospital. When our surgeries are taking place, in the operating theatre, we'll have local hands-on trainees and doctors who are doing the surgery alongside our volunteers, and then that'll be beamed live to the classroom of 48 other doctors and nurses and eye care teams who can be watching it. At any time, any of them can ask questions or ask for what the procedures are that are going on, and the volunteers will stop, talk them through exactly what they're doing, and then often the hands-on trainees will then take over under the guidance of the volunteers, and again that is beamed back to all the other doctors and nurses that are watching the live feed. So it really is a phenomenal and unique training facility. When it comes in, people notice it. We recently took the plane to Cameroon. The President and the whole of the cabinet were there, and they really embraced not just the training and what's happening on the plane, but also the need for eye health within their country. Since then, we are now developing a long-term program in Cameroon. Training is at the heart of what Orbis does. And whether it's through our Flying Eye Hospital, whether it's through our in-country programs, we're all about building the capacity of local doctors, nurses, eye care teams, and then the hospitals itself. So really, all of our work is geared around training local doctors and nurses to be able to deliver better eye care within their communities. Since we began in 1982, Orbis has trained over 300,000 medical professionals, which is a vast number. And as a result of that, over 25 million treatments have been carried out across the world. So it really is a vast number, and each year we are training more and more people. In Africa, we'd like to expand the work we do so that we have 10 paediatric eye care centres across Africa. We currently have 8, so we're well on the way to getting to our target of 10 by 2020. In Ethiopia, we'd like to be able to treat over 20 million people. Globally, we'd like to have our new Flying Eye Hospital operational, but also we want to do more of what we do best. We want to do more children's surgeries, we want to do more adult cataract surgeries, and we also want to move more into the field of research to really underpin the work we do with medical excellence and research, and to work with more governments like we have in places like Ethiopia and China to make sure that eye health is much further up their health agenda, so that actually they are putting more funds and more time and more energy into providing eye care services across their country.